Hello and welcome to the Wellness Trinity podcast, where we interview top holistic experts and bring you natural solutions for modern day wellness. Let's get started with your host, Dr. Jacqueline.
Hi, welcome. Thank you for joining the Wellness Trinity podcast. I'm Dr. Jacqueline from thewellnesstrinity.com, where we provide natural solutions for modern day wellness. Today, we're going to discuss medical marijuana. It's been a hot topic in the last few years, and we're going to debunk some of the questions that you guys have. Just a little disclaimer before we get started. What we discuss in this podcast is for educational and entertainment purposes only. What you do with the information is to be used at your discretion, as the recommendations are not intended to diagnose, treat, cure, or prevent any disease. So this episode was sponsored by Cellcore Biosciences. Creating supplements that work is what they do, and restoring hope and health is who they are. I have been using Cellcore's products and protocols for the last year and have seen incredible results with my clients. Cellcore provides solutions to modern day health challenges, which help people regain their energy and have their life back. I am now one of their account managers for the regions in Oregon and Nevada. So I'm your go-to girl if you are a practitioner that wants to carry Cellcore or does carry Cellcore. And if you're the general public curious about this Cellcore detox and the amazing things it does, please visit my website at thewellnesstrinity.com/Cellcore detox. So today I have a special guest on the show. His name is Dr. Achint Choksy, and you're going to have to tell me how you say your last name.
Choksi.
Choksi, okay. So Dr. Choksy is a board-certified family medicine physician who specializes in the care of patients in ages ranging from 0 to 100 plus years. He received his Bachelor of Science from the Ohio State University with honors and distinction, and earned his medical degree from Avalon University with summa cum laude. He finished his family medicine residency training at Wright State University program. He is now specializing in anti-aging and integrative medicine, which combines natural, herbal, metabolic, functional, nutritional medicine, and medical yoga with conventional medicine to provide a truly holistic, preventative, and personalized care. Dr. Choksy has a special interest in chronic disease reversal, wellness, and preventative medicine. In his spare time, he enjoys spending quality time with his family, playing the piano, being in nature, following up on sports, and serving the community. He is also certified in peptide therapy and in anti-aging and regenerative medicine therapies. He's a yoga teacher and chief medical advisor for the Predict, a genetic lab company as well. So, Dr. Choksy, welcome to the show.
Thank you. Thank you for the introduction and the warm welcome. Thank you.
So we met a few weeks ago at the Eco Workshop, the workshop that Cellcore provides. And I was fascinated that you're a medical doctor that uses all these different types of holistic remedies, including medical marijuana. And I'm sure some of the people listening to the show are also pretty fascinated. I know for you, this is all normal. But for a lot of us, like I would say, speaking from the holistic field, we're always thinking that in general, there's like a disconnect between the medical and people that do holistic type of treatments. And you are really one that integrates the whole thing. And so do you want to talk about how you ended up getting into using all these holistic treatments? Because you were a medical doctor first, right?
Yes. Yeah, so I went to med school. I went to Ohio State, did my pharmaceutical sciences background, graduated with bachelor's. And then going through med school and residency, you wonder, you get trained into learning and doing the protocols and doing the research. And at some point you realize and you ask yourself, why are you there? Right? What is your purpose on this planet? Right? At some point, we have all written some kind of essays that got us admitted into undergrad or med school, and the question has been the same. And every 4 years, somebody asks us, what are you doing? Why are you here? And same thing happened to me going through residency. The first couple of years were just, you're getting your feet wet into learning the entire medical system. And then the third year, when you finally feel that you're about to graduate and you have done your due diligence to become an MD, And then somebody comes in and asks you a question that, how are you, and then as a family doc, my goal is to be with the patient, right? I'm going to be taking care of these patients for a long time. And then one of them asked me, like, hey doc, why do you think this happened? Like, why do I have rheumatoid arthritis? Like, are you concerned about reversing my diabetes, or do you just want to give me more and more medications? We started with metformin a year ago, and now we are on glyburide or glipizide, and then another pioglitazone or whatever, right? We're adding more and more, and then we're on insulin. And then those kind of questions came to me from my patients, and I realized that I didn't have the answers. And I didn't know why things happen. I didn't know why pretty much any autoimmune diseases happen, not even diabetes or blood pressure, right? We have some ideas of from the lab perspective, whether it's endocrine related issues or if it's some kind of autoimmune issues, but we don't know why things happen. And I did not want to be the doctor who took care of one family, one person for a long time as a family doc. It just didn't feel right to give them the same medication over and over again. 20 years later, my life work is done, and all I have to say is, hey, I've tried my best and to help you and not be able to reverse the conditions. So going through med school, going through residency, all of us in the field, at some point we feel our egos are completely broken down. And then when we graduate, we feel really egoistic that we do know some stuff, right? We become, because of the prestige and because of how a lot of people still hold you up high in regards, sometimes that blocks you from looking at the other realm, right? I asked my question that, how did people live 1,000 years ago, right? What did they do? What kind of things were out there? And my background is I'm Indian. I was really young when I moved to the United States. But that kind of started playing in my mind that, oh yeah, I remember my grandmother gave me this little thing to clear up my gut, or this little thing on my chest to clear up my sinuses, and it always worked. Or she put something in my belly button, and she used to give me something during the full moon cycle. And it was something that just stuck and said, okay, there's something that I don't understand, right? I just don't get why things happen. And this is the mechanism of action. Going through med school, they teach us, understand the mechanism of actions of how drugs work, how they change your physiology and pathophysiology. Well, energy changes that. Any of these, if I go into a hot climate, my DNA will start producing, transcribing and translating something that produces sweat. So those proteins are being produced. But that only happened because my environment changed. So how did my body know to turn on the DNA, that specific gene, specific areas in my body, whether it was my underarms or my chest or my lower back or my thighs, and not on my face? How does the body know to convert some of these things to cool you down, right? The goal is to cool you down. So sweat does that. And I didn't know how it was happening. So I started looking at other things that I've heard, whether it was marijuana, whether it was anti-aging medicine, Ayurveda, yoga, just started doing different things and learning about them. And as a medical doctor, we're taught to go deep down into anything that we're doing. Really get to know something. When you want to learn something, learn all the way. Don't half-ass it, right? Pardon my language, but hopefully. But so yoga was one of them. I wanted to practice what I was preaching, and patients, we're always, one of the recommendations as a doctor was, hey, do your exercise and go out and exercise and do your diet, or go do yoga and go do some kind of stretching. But I didn't know what that meant, like, really. And when I talked to physical therapists, they didn't know what they meant. When I talked to exercise physiologists, they didn't also know what that meant either. So a lot of people just don't know, and they're just spreading this without knowing, right? So 2 years ago, before I started my practice here, I went to India, gave up everything, and did 14 hours a day of yoga, lived in the temples, like in the pyramid centers. And I went to the best yoga place that was there that was non-religious, because I didn't want to be influenced by religion or any kind of philosophical background, and really started doing yoga. And that's when I understood, the teachers were telling us, they're like, hey, do this warrior pose, but breathe this way for 1 minute and tell us what you feel. And then do the same pose, but do it for 5 minutes and then tell us what you feel. And then do it for 2 hours and then tell us what you feel. As I started doing them, I started realizing, putting two things together, one and one, that my body's hormones were changing. I was releasing different hormones as I was doing things differently, as I was breathing differently. And that is something that, pretty much most yoga teachers don't know, right? They're just teaching one type of class to everybody. But the type of class that I teach in my practice is very personalized to that person, because we're changing that. During yoga, I learned something that about energy, and that's what all this is. Everything is about energy. Plants have energy, right? There are 5 elements: earth, water, fire, air, space. Each of these things have energy. When we look at plants, marijuana is one of them, and it's been used for hundreds of thousands of years by most of the doctors in the world. They used to carry it around in their medicine bag when people used to go out and fight wars. This was one of the first line treatments. They used to have creams that they would apply on wounds. But for thousands of years, this has been used because of its medicinal properties. But same way, turmeric has been used, and every other plant. So I started looking at the energy of everything. And while I was going through my yoga training, I realized that this is all about energy. I started looking at energy of people instead of patients. I'm now only looking at energy. When patients are sitting in front of me, I'm looking at their energy. It has nothing to do with anything else other than the energy flow in their body around them, and what has brought to them, like what brought them to this point in their life, right? And the energy started when their conception started. Marijuana was just one of them out of, we have hundreds of thousands of herbs that are out there. And marijuana, because of this whole system and how it was placed and the history behind it, how it was placed as a drug instead of the herb, in 1920s and early 20th century, they started derogatory terms and all that stuff against certain population, and this marijuana, which was a medicinal plant, ended up becoming a drug. But and how it was laced with cocaine and heroin, and now it's coming out of it, right? Most people are realizing this. Canada made it recreational. US will probably make it recreational in the next 5 to 10 years as well. So there's real value. And as a doctor, I wanted to know exactly how people what they're putting in their body and how it connects them to their medical world, because more than 50% of the US uses herbs, some type of supplements, but almost maybe less than 10% of the universities actually teach doctors how they blend in, right? How does turmeric change Coumadin? Very rarely you'll learn all of those interactions in med school. As marijuana was becoming much more prevalent and the use of it was becoming much more prevalent, it became a responsibility for me to learn about them, because people are using it. As a doctor, if somebody's sitting in front of me, it's my job to guide them, right? I'm a messenger, I'm a guide. So it's my job to know things about that. And especially when I had 0 hours of lectures in medical school on endocannabinoid system. So when we don't get taught, you just have to go out and learn, right? It's my duty to provide as much proper guidance to my patients as possible, and that's my oath, right? I will try to do as much as I can to learn something so that patients can get benefit from it. By not knowing something, I am causing somebody harm.
Mm.
Do
Yeah.
no, our Hippocratic oath was do no harm. If you can't do good, do no harm. And do no harm means know enough information, because not knowing can cause harm.
Mm.
And most doctors, most of us, we have this ego about ourselves that we know everything and everything is research based. Well, even if it's not research based, we can take a couple steps to learn about these things, go out, do conferences, learn them, practice them on yourselves, really just experiment and
Mm.
slowly build that data and evidence.
Yeah.
So I think it's happening, and that's where I am right now, just looking at all the energy flow of pretty much all the plants, and marijuana is one of them.
Mm-hmm. Yeah. So I appreciate your humility and that even though you went through medical school, you didn't come out thinking that there's not anything else to learn. And that you're able to look at the whole picture and make your own conclusions from that. I think it's a beautiful thing as a medical doctor.
Thank you.
And the other thing that when we chatted a couple weeks at the seminar, I had asked you, like, how does a medical doctor pick up something like Cellcore, which is an incredible holistic solution? And you were talking about how it's important to have studies behind products and protocols that you use. And so it doesn't sound like medical marijuana has as much as it needs to have. Do you know where it's at with that at this point?
So a lot of people are doing a lot of studies, right? In the world of genomics and proteomics, and the world is moving towards precision medicine at an insanely fast rate. And even in the holistic world, where I would say that uh, we need to move into the world of precision medicine, really understand the gene transcription and translation of and how it happens, right? If just by changing the environment to making this room hot, my gene transcription and translation is changing to producing sweat glands, which are protein molecules, right? It's producing something right here in my armpits, then we really need to know that whenever we put something in, through all of our senses, we're putting in supplements. Cellcore is one of them. There are other brands are one of them. Cellcore is by far one of the best. I absolutely agree with you. I have had miracles happen to my patients, and they continue to happen even today. And it's fascinating. But this comes down in the world of research, and when we're looking at the world of research is going towards minute understanding of the DNA, transcription, translation, the genes, the electrons, all of that. Now, marijuana is in that place right now where a lot of people are looking at which gene is marijuana actually translating, which gene is marijuana actually transcribing, right? Or which mRNA. Transcribing and translating is the other way around, but DNA gets transcripted and mRNA gets translated. But what that means to everybody else who's listening to this, it means that DNA gets read, and then a sequence of amino acids, or sequence of the A's and T's and the G's and the U's, all of that gets placed, which is called mRNA, and that gets read again, and basically that's where we make the proteins, and then protein gets to do what it needs to do in our body, whether it's to produce hormones. Some hormones are produced in mitochondria, some gets used by the DNA. We are right now looking at all those research for marijuana, right? And that research is saying too much of one thing. If you are in a lot of pain, if you have a lot of diseases, if your gene transcription, translation, your gene genetic sequences are already messed up and you're already in the hole, then maybe marijuana will help, because it will turn those gene sequences off, and it may bring you out of certain diseases, right?
Mm-hmm.
People have used it for autoimmune diseases, to cells that rapidly grow fast. So you can use it. There are a lot of case studies that are out there, individual studies that are out there, some controlled studies that are out there. But why is it happening? You know, how come endocannabinoid system is behaving the way it does? How we have this system in our body, we are able to produce our own endogenous endocannabinoids. We can stimulate our C1, C2, or CB1, CB2 receptors, and the entire system gets stimulated with our own endocannabinoids that we can produce. Can we use these things, such as marijuana or extracts of marijuana, different, THC, CBD, there's tons of other ones. But how do we know which genes is it turning on and off? So there's some evidence and some data that is right now that's out there that says it can actually turn on a cancer gene and it can actually turn off a cancer gene. Who needs to take it? We need more data. We need more data because the government, Canada, it made it recreational. So pretty much everybody will start using it. United States, about 40 states have made it medicinally available, and some states have already made it recreational. So it's going to be available to everybody if it's not already. Are we going to follow the masses and say, oh yeah, it's good for everybody? And if you have learned anything from the past, we know that nothing is good for everybody, right? There's always something, even if it's good, there's always something that has a side effect. So we really need to understand that this one plant, it has a lot of energy. How is that energy changing the DNA? And how is it actually manifesting in 20,000 genes that we have and more? How is it actually manifesting, transcribing and translating? Because just like a hormonal system, endocannabinoid system also is a system of interaction. It's a system of communication between cells. And these cells, at the end of the day, are a universe in themselves, right? One cell has an entire universe in them. It already knows how to behave when the environment outside the epigenetics change, right? Epigenetics outside the genome. When that changes, our cell knows how to behave. So when we get exposed to this particular plant or turmeric or any other plant or any other non-plant man-made, chemicals, our body knows how to balance it. It's the yin and yang, right? It's the day and the night. It's the sun and the moon that's in within us that we really need to understand that how is it actually turning on. So the data will come out in the next few years. There's a lot more data will come out that will tell us whether we're on the right path or not. And what I would say is if you don't have any diseases, be very mindful of being exposed to it daily, because it can put you into a zone of negative reactions, right? What if your cancer suppressor genes get turned off? And now you have tumor suppressor genes are turned off, and you might feel good mentally and emotionally because you're taking this, and it does help you feel relaxed. It does help you with memory and energy and all that stuff. But what if it turns on oncogene, right? So we have that data that's out there right now, and the clinical studies will follow, obviously, with like any other thing. Lot of efforts are behind this, right? I mean, there's a lot of people who are after making sure, because this is becoming widely available, so we have to make sure that we have enough data behind CBD. So the entire world, from Australia to America, everybody in between, is doing research on the effects of different types of plants, different strains of CBD, and which strain is better for which disease and which gene sequencing is better. So that's happening. I have had great results with my patients. Amazing results, to be honest. To some degree, we can even call it miracles. But people have gotten better. They had the disease, and we used the epigenetic, which is the plant. We use that to change the internal environment.
Mm-hmm.
Their internal environment to begin with was bad, whether it was cancer or autoimmune disease. It was already not optimal. So then we used these plants. Well, marijuana is just one of them, but we use these plants, and Cellcore has a bunch of other ones that are in there in their supplements. So we use these plants to change the patient's current disease state into a healthy state.
Mm-hmm.
But we need to really know which genes are getting activated, what genes are getting turned on and off. And that data will come out, whether it's for Cellcore, whether it's for other herbal companies, whether it's for marijuana, whether it's for different types of marijuana. It will come out. We will know, we will get much better. It's not a one blanket that fits all.
Yeah.
Yeah.
And when we're talking about medical marijuana, you're using the THC as well, right? Because there's a lot of people that use just CBD without the THC or with very minimal
Yeah.
amounts of it.
Yeah. So I have used mostly just the hemp or the CBD oil and the products that they can get at the dispensaries. A lot of people who have the marijuana plant, the card, from the state of Ohio, I'm able to get them a card that they can use, medicinal marijuana card. They have tried THC. I've only done it for a short amount of time and have taken them off of it because I do a lot of other things that also change the neuronal chemistry. So because of this understanding of the genetics and how it actually changes, I do it in trial burst, 6 weeks on, 6 weeks off, and then allow the body to empower itself, because we do have the ability to produce these endocannabinoids in our own body because this is our own system. We can make them. We don't have to be dependent on something else, but we do need to be trained in making it, or we need that little push. We need that little push to get somebody going. Once I teach you how to ride a plane, you'll know how to ride a plane. I don't have to be next to you all the time. That's what we're doing. That's how I'm doing it, right? I'm giving my patients certain trials, certain doses, or recommending them. They're getting them from the dispensaries or from some of the reputable companies that have hemp oil or hemp extracts. It's usually the flower extract, not the seed. So there's a huge difference between getting it on Amazon and getting it from of really good reputable companies, because most of the stuff that's sold in the market is the seed, not the flower. And most people have no clue and they're just wasting their money.
Yeah, I've heard that too. Even the one I carry is from the flower, the
Yeah.
CBD. I don't have anything with THC.
Yeah.
But can you explain what the difference is if they take it from a flower versus a seed?
The flower is more potent. The seed doesn't have all the full spectrum in it. The flower is where all the oils are. If you look at any essential oils, right? I mean, whether you look at essential oils, homeopathy, Bach remedies, everything is all about getting things off of the flower. Right? There's very rarely things that come from the seeds. Obviously, it's valuable. Seed has a lot of stuff in it, but very rarely you can get what flower has. So what is the difference? Seed is a seed. It needs water, it needs air, it needs sunlight, it needs nurture, love, and care. Flower is the final product. The difference in those energies are totally different. When you take the seed oil, you have to add a lot of other things to get the best benefit. But how are you going to replicate the ground in your body? You won't. The seed isn't going to grow into a flower, right? When a seed is in the earth, it changes into a full-blown plant, into a flower, and then the flower is exposed to the air and the sunlight and all that. So there are a lot more phytonutrients and chemicals that are inside the flower than in the seed.
Okay.
Because what the plant has done in the growth process.
Hmm. Okay. So why have you taken your patients off of, or suggested at least that they get off of the plants with more THC?
Why have I taken them off?
Yeah, why, what, in what situations or
Oh, okay, okay,
would
okay.
you have, have you suggested that they not take
My
THC?
my perspective is that when somebody comes in with some issue, right? My perspective is that I want to empower their body. My perspective is in to say, hey, you're in this deep hole and you're going to be dependent on this all your life.
Hmm.
I want to stimulate the body, cause a little bit of pain, and body will do its thing. You already have the genes to do everything that you need. In the world of farming and planting and growing our own gardens, when we plant the seeds, we sometimes put very little water in them. Why? Because the seed has to struggle. You have to allow the seed to struggle so that it grows its roots deeper and deeper and deeper.
Hmm.
And same thing for us. In the world of anti-aging, you have to cause a little bit of trauma, little bit of, you help them, and then you say, hey, look, why don't you do it on your own? Let's see if you reset the receptors, desensitize them and resensitize them. So although marijuana is not, or THC is not, from that perspective, addictive, I still don't want people to be dependent on it. I
Hmm.
want people I want people to think that they can do it on their own
Hmm.
and get out of it. Most people will try them, and then over time, what I have noticed is that if I started somebody on a high dose THC, by 1 year's end, they will be like 1/8 of it. Like they will get the same pain relief or same benefit to their mood and depression and anxiety and whatever that we're treating, but they'll need like 1/8 or 1/4 of what they actually started with,
Hmm.
because their bodies are now doing much better. We are,
So
yeah.
you would use it for in a situation where people have more pain. I hear, I haven't had that type of extreme pain, but I hear from people that have pain, um, they say the real stuff, the stuff with the THC versus just the CBD.
You can. Some people might need it. I have used it for some people for sure, but I do a lot of other things that I think, including the Cellcore line, that I feel like it gives us better results much faster.
Mm-hmm.
But some people just need both of them. They need THC and CBD. And
Mm-hmm.
then some people will just respond really well with just over-the-counter CBD, have full spectrum extract.
Mm-hmm.
Um, but it depends on the person to person, but I have used it, absolutely.
Yeah. But it sounds like in general, more so, do you feel like there's a lot of other ways that people can deal with their pain that's more effective than going that route?
I think so, yes.
Yeah. So why don't we go dive in a little bit of why people have pain in the first place?
Okay. Why people have pain? Well, pain is a feeling. Pain is a feeling and emotion. It can happen from inflammation, right? It can happen because they might have toxins build up in their body. It may is a symptom. Pain is also a symptom because there's something else that has happened in your natural way of being that is being blocked, and your body isn't able to do what it needs to do. So it has to adapt. In that adaptive process, if we have nerves there, if there are things that are depending on the organ, if your body doesn't adapt completely fast enough, then there will be some pain.
Mhm.
And that's what pain is. Pain tells us if we need to look deep down below the surface and really look for the root cause of why things are there. It could be parasite. It could
Mhm.
be our body in its natural state doesn't have that much pain. When we get exposed to all these things that we've been exposed to over the course of many years of living, whether it's man-made chemical, environmental toxins, some things that we can't even see, whether it's the viruses or the Wi-Fi.
Mhm.
our body tries to adapt, and then adaptive process, it uses different nerves, it uses those signals, they go into the brain, and our brain says, I can't adapt fast enough. So it causes pain, right? When we work out, we're breaking down our muscle fibers. That causes pain. But we're constantly adapting. We're allowing our subconscious mind to say, you know what, I accept this pain. And then it doesn't hurt more.
Mm.
So some things we can accept, some things we shouldn't accept. I would not accept parasite living inside my gut, you know?
I really appreciate you saying that, because I know that the people that follow me know that I love to talk about getting those little critters out.
Oh, really?
Because I don't accept it either. And a lot of people don't realize that their pain could be because of a parasite or some other toxin, and their terrain, basically what you're talking about, their environment and their body is dirty. And so
Exactly.
I fully agree that um, yeah, you don't want to be in pain, and sometimes maybe we need to do some things in the beginning to just get that immediate pain away as much as possible. But we have to always go back to what is the root issue, and that's why I asked you.
Right.
I wanted to see what you would say, because um, when we deal with these root issues, you're right. Like, we shouldn't have to deal with pain, and CBD. I use
Yeah.
CBD as well too. I think it's fabulous. I don't use the THC products, but
Yeah.
I respect if somebody feels like they need it for a period of time. And of course, you would probably agree, we have to get a good source, right?
Yeah.
If we're going to use
Yeah. We
any
have
of
to get
it.
a really good source.
And but the main thing that I wanted to kind of pull out of you is exactly that. We need to get to the root if we're going to get out of our pain. And
Mm.
CBD can do some of it, but it's not necessarily going to be the end all be all for every single uh, root, right?
Right. Right. Yeah. So we know coronavirus or any other viruses mutate, right? They adapt. You know how fast they're adapting? Literally every single day in our body. Drug bacterial resistance, right? Bacterial resistance, that, or drug MRSA or any of these bacteria, they're also adapting to their environment. In order to, if we keep getting exposed to toxins, our body has to adapt. If we keep putting in a band-aid that just controls the pain and maybe helps us detox a little bit, but not much, we're doing a little bit, but not enough, right? This is so common. People all think that they're having a good diet, and they think that they're doing enough, but they're not doing enough.
Mm-hmm.
It's just a myth that, oh yeah, I'm living a holistic life, but I'm doing everything. I'm getting organic food, but come on, are you really getting organic food? Right? Are you doing enough to get some understanding? And if you have parasites, they will mutate, they will adapt.
Mm-hmm.
They will adapt to the CBD, they will adapt to the full spectrum. And full spectrum has some THC in it, and I think that's natural, that's pretty reasonable, less than 0.3, I think. And I like those products a lot more than just a straight up THC. But it's any plant, and they will adapt. Bugs will adapt in your body. If you have toxins such as glyphosates and heavy metals that are sitting there, your body will move them. It may make them go from one place to another because you're doing certain things. But then you need certain things that pull them out, and you might need electromagnetic stimulation to help do that much better and much faster.
Mm.
Supplements are one story, mind is another, right?
Mm-hmm. Yeah.
Yeah.
Yeah. Well, I really appreciate your holistic approach, and how, you're really considering how we are mind, a body, and spirit, and looking at the whole picture and making your own conclusions from that. And really, I'm sure your patients really get fabulous results. I don't doubt that at all.
Yeah, it's been amazing. And last whole year, I've maybe only prescribed maybe 20 times.
Mhm.
Year, like almost 2 years now. Like the last time I prescribed any type of diabetic medicine was like maybe 3 years ago. Like
Wow.
I shouldn't say things like this, but patients who come to me for diabetes, they go and they leave without diabetes.
Wow.
Like 100%. Like not a single patient in here that has. So things like that has happened. Rheumatoid arthritis to many other conditions that I'd like not to make those claims, but at some point, it's really rewarding to see that, we can do things naturally. I do prescribe low dose naltrexone. I do IV therapies. I do, yeah.
And they
But
do their parasites.
But yeah, they do their parasites. It's so important.
It's very
So
important. I'm sure you have
important to
pictures
do.
of those as well too. Those Cellcore products are no joke with the parasites, huh?
Yeah, they're not. It's amazing when somebody gets on them. It's insane. I do combine Cellcore with a few other things that I know
Right.
about different herbs from traditional Chinese medicine and Ayurveda, and there are other things that we have in our office. But combining those things is essential, right? And then some point, if they need stem cells and peptides and those kind of things, we can do them as well. It's almost a guarantee that somebody will change their life. Like if they're here, they will change their life. That's how it is. And that's what you're doing as well. People will change their life.
Yeah. Yeah, it's a really awesome space to be in when you can give hope to people that really are searching for solutions and especially the ones that are at the point where they're very, very in need of it.
Yeah.
So
one last gift I want to, or gift or just tidbits of knowledge that I would like to tell people, since we're talking about all these things. I think in today's world with coronavirus and everything, people might want to know what I would do with coronavirus. So with research-oriented mind, we have enough research that says vitamin D, 10,000 international units, is really good for immunity and viral infections, including coronavirus. We have some amount of research that says vitamin C is really good, but we might have to do 2,000 milligrams every 2 to 4 hours. And if it causes any kind of GI issues, add magnesium and some potassium or banana to it. Then third thing I do with my patient is zinc, because zinc blocks the RNA polymerase or reverse transcriptase that's in there. So, but it has to go in there, right? It has to go inside the cell. Otherwise, it's usually outside. But take them with you. As long as you're loading up on zinc, 30 milligrams twice a day, that can also help. Now, the other thing is fasting. Fasting is insanely important. Waterless fast is insanely important. If you feel like you're sick, pump yourself up with vitamins and those things, and then fast, because fasting will empower your immune system and it will strengthen your T cells and B cells. Scientifically proven studies are out there. Nobel Prize have been won behind this data. So, 1 day fast, waterless, eat the next day. 1 day fast, waterless, eat the next day. Because the lungs are getting filled with what? Water. That's what's killing people. That's what ARDS is. So just allow yourself to empower yourself that much faster.
No water.
No water.
Wow. So dry fasting pretty much. No water, no food.
No water, no food.
Wow.
1 day. 1 day per week, at least, if you're sick, right? And it's doable. It's not hard. All of my patients do it. So, and everybody who's scared, they also do it, and they just do fine afterwards. It empowers the T cells and the B cells, and it just strengthens the immune system. You have to look at this as a city, right? If my city is blocked off, if no resources are coming into my city, what am I going to go after? What is my police going to do? My police is going to stop all the people who are using up my resources. My police is my immune system. My immune system will go out and hunt for anything that is rapidly dividing, whether it's cancer or bacteria or viruses. It will go out and hunt them down. This is called autophagy. Your body will say, you don't belong here. I need my resources for myself. You are using up my resources, so I will kill you. And that's what happens your body goes out and kills anything that is using up your resources. This is what we would do in our city, right? If our cities are on a lockdown, our police is everywhere, right? They're heightened. They're looking out to stop people from using up resources. And the other last thing I would do is something called I'll just show it to you. So people who are paying attention, you exhale all the way out, breathe in through your right nostril, hold, breathe out through your left nostril. So 3 seconds in, hold 1, 2, or 3 seconds, whatever you can do, breathe out through your left. Again, do the same thing. Breathe in, hold, breathe out. So breathe in through the right, breathe out through the left. When you're breathing in, breathe in through your stomach. Get the air all the way down. So that's something that will activate the heat in your body. This is according to the meridian systems and the Eastern philosophies of Nadi and the sun element in your body will get activated. So that can also help with fighting off these kind of infections. You know, I don't have data to prove that, but that's something that you just can do and see if it works for you.
Well, it makes sense. We're dealing with a respiratory infection. So a lot of people are being starved of their oxygen. So, but I mean, most people probably never deep breathe anyway. I mean, we're just always on the go and just, I mean, we're naturally probably like breathing like that, whether we realize it or not, just because when we're in that flight or flight response, which many of us Americans are naturally, and then you throw something like coronavirus on and it's just probably even way more heightened.
I have added ViRadChem. That's a Cellcore product. I have also added the oxygen, the molecular oxygen, and doTERRA's On Guard and Breathe, and lemongrass.
Those are good too. Yeah, I also have been using the oxygen and the ViRadChem, and we've been using doTERRA in some of our products too, the On Guard. But that Breathe is fabulous too. I think that is also
adding On Guard, Breathe, and lemongrass, because lemongrass pretty much kills all the bugs as well. It's insanely strong. I mean, I sprayed lemongrass around my window and it killed all the ants. I mean, I don't like I don't like killing them, but I didn't know that I was gonna do that. Was my first experience with lemongrass oil.
I'm really happy to know that, cause just in case I ever ants, because I do not like ants or toxins that you have to kill the ants with.
Yeah, so we have this oil. It's lemongrass, and the main ingredient is just lemongrass, and it's fractionated water, and I mean coconut oil and water, and you just spray around the window, and those little red ants that are there in the summertime, I didn't know it was going to kill them. It just said bug repellent, so I sprayed it, and next thing I know, they're all dying. I was like, oh my God, I'm so sorry.
They don't belong there anyway. And since we talked about marijuana and actually it seems like you're more into the CBD, which that's what I use too normally. That probably might not be a bad idea for people that have a lot of anxiety during this time too, right?
Oh, absolutely. I would start with 5 to 10 drops, or 5 to 10 milligrams of it, and then allow your body to respond. Increase it after a week or something like that. Don't keep increasing it. Higher the dose, the less the response. So you're better off doing it slowly.
Okay, perfect.
Yeah.
All right. Well, it was such a pleasure to have you on the show and talk about medical marijuana and tie this all into what's going on with the coronavirus. And where can the listeners find you?
They can find me on my website. It's www.aceintegrativehealth.com. So it's ACE integrative, INTEGRATIVE, health, HEALTH.com. And if they want to call us or text us, they can at 513-280-8891. I am on Facebook, on Instagram. They can find us there as well under ACE Health.
Sorry, you
pages.
cut out at that point. What is
and
you cut out for a second?
I said ACE Integrative Health.
Okay.
On Instagram or Facebook, or on my website at aceintegrativehealth.com.
Okay.
Yeah, or they can call us if they want to. That's fine. I have patients from all over the world, from Hong Kong to California. So we do a lot of telemedicine and those kind of things. So
oh, perfect. Yeah, that's what's definitely needed now in this time where we're
yeah.
pretty much all in our house trying to figure out how to do life.
Yeah. One other thing about coronavirus is we're coming out with a blood test and a stool test that you can do in your home for coronavirus. So there was a research study that just came out of China that said people who are negative in their nasal swab for the coronavirus, they were positive in their stool for coronavirus. So you could be negative
Wow.
in your nose and think that you're perfectly fine, but then you're still shedding and transmitting the virus to other people because there's fecal oral transmission, and it's in your gut and it's living there. So it becomes really essential to get on a good protocol, and so we're coming out with that. So if people wanted to do that, we can also order that
Oh,
online
perfect.
anywhere in the world, pretty anywhere in the country, pretty much.
Okay, so you
And
actually diagnose, because you're a medical doctor, so you actually diagnose people with coronavirus then?
yeah,
Okay, okay,
yeah.
good to know. I'll make sure I keep you in mind if
Yeah,
I
I mean, if you
that.
look at any kind of flu testing, flu test is anywhere between, I mean, there's, 20 to 40% false negatives on the flu test. Same thing with any type of nasal swabs, like it's operator dependent. If it's all the way in, if it's collecting all the DNA, if it doesn't, then you're going to have a negative viral test. So I like to look at the blood. So we would do a blood test and we can do a stool test and really look at the viral DNA and or viral RNA for matter of fact.
So
So
for telemedicine, when is this these tests going to be available?
Monday. So
Monday.
anybody
So
can just call us and we can get them signed up and order the test and they would pay for it. The test itself is quite expensive, so it's about $400, but we can, that's the best I can do. I mean, that's what they charge. So,
yeah.
but
Okay.
we're doing a stool testing, right? We're literally looking at under the microscope. So it takes a lot of, and the genetic world takes a little bit of effort to do those things.
Yeah. Yeah, lab testing is usually not cheap anyway, so I'm
Yeah.
not surprised at the price
Yeah.
if people have to pay out of pocket.
Yeah.
So the Monday, for any of you guys that are watching this at any other time, it's going to be March 23rd, 2020.
Right. Yeah. And that's the best price I have at this point, right? Like, if they come out and say it's $450, then it might be $450. I'm just going to try to help as many people as I can
Yeah.
to get these testing done. But yeah, we just got to get them done.
Yeah. Yeah. Well, thank you again for coming on the show. I really appreciate your time. I know that you're busy with helping people with this coronavirus and other issues that people are dealing with in the world right now. So thank you. Thank you so much. And
yeah, thank you so much for having me and giving me your time and listening to all the listeners. You guys are all awesome. Thank you. Stay positive. Vibrations of fear and negativity are very low. So we have to change our vibrational state and use this time as the best time in the world, right? Change yourself into positive beings.
Yes. Yeah. Thank you, listeners, for
Thank you.
watching. We really appreciate you coming on the show and listening to us every week, listeners, and we will have you join in again next week. I'm Dr. Jacqueline. I'm here so you know. My Super Immunity Boost Juice Guide is now available on thewellnesstrinity.com. You'll learn how to grow broccoli microgreens, the ingredients I put in my green juice, and super nutritious supplements you can add to enhance your immune system. Again, go to thewellnesstrinity.com and you'll receive your free Super Immunity Boost Juice Guide.
Thank you for listening to the Wellness Trinity podcast. Be sure to subscribe for more wellness tips to help you achieve optimal health. Don't forget to rate and review so we can continue to bring you the best content. See you on the next episode.